Since the resurgence of polio in Nigeria 2 months ago, the National Primary Healthcare Development Agency, the agency in charge of vaccines and immunization, has intensified emergency immunization of children across 18 states in the north. This workshop is organized to strengthen advocacy for immunization through data. The head of routine immunization at the National Primary Healthcare Development Agency says lack of accurate data affects improved immunization, especially in remote areas. He also explains that such data is important for health financing.
Before you can plan, you need to have enough information to know what you are planning for. And for immunization and the EPI as a whole, there's no way you have a good output without a good planning. And to plan, you definitely need to have good data. So, in other words, data is needed to plan for an improved service delivery in the country.
Meanwhile, representatives of health development partners at the forum say the lack of such data also hamper effectiveness of finance advocacy for vaccines and immunization.
The Gavi Alliance does actually support Nigeria in their immunization programs, but one day Nigeria will graduate from that assistance and will need to completely fund immunization on its own. So I think there's a need even now to begin helping policymakers really understand that immunization has an impact on the population through the lifespan.
Data from Nigeria is important, and they don't have access to that. They don't know where to get access to it. And even though there might be some data, because they don't know where to get access to it, then it doesn't come into the advocacy that they do, that they execute.
Health officials at this gathering say over 28 million doses of polio vaccines have been distributed in 18 states of the north to combat polio resurgence. Although the exercise targets children under the age of 5, there is no accurate data of how many eligible children exist in the region.